Hello everyone, my name's Rose and I'm from Santa Clara University. Today I'm going to talk about mindfulness in schools. Before we get into the main topic, let's first address what is mindfulness. According to Kabat-Zinn, mindfulness is the awareness that emerges through paying attention on purpose in the present moment and non-judgmentally to the unfolding of experience moment by moment. And there are increasingly convincing data support the benefits of mindfulness practice in adults by improving health and well-being. Today, we are going to talk about mindfulness training in school. There are two types of mindfulness training. The first is offering mindfulness training to K-12 teachers, since teachers face a variety of stress and have few resources to alleviate them. The second one is offering mindfulness training to K-12 students, which mindfulness might enhance students' learning and achievement, improving students' ability in self-regulations of emotions and attentions, and also might help alleviate stress. The first article is about mindfulness training for elementary school students. The purpose of this study is to see whether participating in a mindfulness training program affects students' outcome on measures of attention. In this study, participants attended the Attention Academic Program as their mindfulness training program. The purpose of the AAP was to help students improve their life quality by practicing mindfulness. Three goals of the program to help students learn to: first, increase attention to the present experience; second, approach each experience without judgment; third, view each experience as novel and new with beginner's eyes. For the result of this study, the pre-test post-test showed that children from the experimental group had fewer problems noted by teachers. There's also a significant decrease in text anxiety score and an increase in selective attention score. Based on the graph, the experimental group performed much better than did the control group post-intervention. The implication of this study is to incorporating mindfulness training into the physical education curriculum as health education. It is an ideal way to begin teaching children at an early age how to cope with stress and anxiety and self-regulation or tension. With increased in stress, depression, and anxiety that children have, it is crucial that children learn techniques for reducing feelings of stress. Therefore, it is recommended to include mindfulness training into the curriculum at the early ages of school. The second study is about mindfulness training for middle school age children. The purpose of this study is to see whether participating in the mindfulness-based cognitive therapists for children's program affects children's outcome on measures of attention, anxiety, and behavior problems. For the result, researchers found significant reductions of attention problems over time, and some reduction in anxiety symptoms, and some reduction in behavior problems. The implication of this study is similar as the first articles. Anxiety can damage one's attention and promotes emotionally reactive behaviors that interfere with the development of good study skills. Therefore, it is important and reasonable to implement the mindfulness program in schools. The next study is about mindfulness training for adolescents. The aim of this study is to report and evaluate about the learning to breathe. Learning to breathe is a mindfulness curriculum for adolescents created for a classroom setting. The goal of this curriculum is to cultivate emotional balance through the practice of mindfulness. This table shows the result of these studies. Compared to the pre-test score, there is a significant reduction in negative affect and a significant increase in feeling calm, relaxed, and self-accepting. Mental health problems are increasingly among young people, such as depression and general anxiety disorder, which used to be among adults but now is affecting the younger generation. There is a quote taken from the article saying that school systems are not responsible for meeting every need of their students, but when the need directly affects learnings, the school must meet the challenge. Stress and anxiety directly affect students' learning, and mindfulness shows signs of alleviate them. The study conducted by the Broderick and mates also showed signs of reducing negative effects and increasing self-acceptance after participating in the mindfulness program. Therefore, it is important for schools' curriculum to include mindfulness classes. The following article is about mindfulness training for adolescents and adults with ADHD. The purpose of this study is to evaluate the feasibility of the mindfulness practice and explore its impact on ADHD symptoms, comorbid behaviors, and cognitive performance. This table shows the result of these studies. One of the most important findings of this study is that ADHD symptoms like inattentive decreased significantly after mindfulness training. There are increasing data suggesting that meditation is recognized as a mental training that could regulate attention and brain function. Lots of research proves that mindfulness practice has an impact on treating ADHD or alleviating symptoms of ADHD. Therefore, it serves as alternative treatments for ADHD. ADHD is most common among teenagers, and there are no side effects for practicing mindfulness. Therefore, parents can use mindfulness practice to teach their children to reduce ADHD symptoms. The last study is about mindfulness training for teachers. Cultivating Awareness and Resilience in Education, aka CARE, is a mindfulness-based professional development program designed to reduce stress and improve teachers' performance in classroom learning environments. The prosocial classroom theoretical model emphasized the significance of teachers' social and emotional competence and well-being in the development and maintenance of supported teacher-students relationship, effective classroom management, and social and emotional learning program effectiveness. The purpose of this study is to examine whether the CARE professional development program can improve teachers' social emotional competence and well-being. This is the logic models of the CARE interventions. The researcher presented these four graphs as a result of CARE had significant positive effects on teachers' general well-being, efficacy, burnout or time pressures, and mindfulness. Teacher stress and burnout is a serious problem in education today. School psychologists are increasingly being called to provide support to teachers and consult on matters related to and or associated with teacher stress that impacts performance. CARE is a promising program that psychologists can use to address the issues of providing supports for teachers. CARE may reduce teacher stress and burnout, which may reduce school district costs in terms of personal health care costs. Therefore, it is important that all teachers to attend programs such as CARE and to learn how to alleviate them stress. Besides the 5 articles that I reviewed there is a lot of literature backed up the benefit of mindfulness practice on self-regulate emotion, alleviate stress, anxiety, and ADHD symptoms. For both students and teachers' physical and mental health, schools should incorporate mindfulness training into K-12 education curriculums. Thank you for listening, and this is my reference.